San Diego Connect.
We're talking again today with Dr. Timothy Bailey, founder of the AMCR Research Institute of San Diego. It is a leader worldwide in diagnosis and treatment of metabolic diseases. Doctor, last time we talked about the prevalence of diabetes late in life for people, very often undiagnosed. Are there treatments that are available for seniors specifically?
Well, that's something that's very important because the drugs that we have for seniors are exactly the same drugs as for other people.
Okay.
But seniors can have more vulnerable to some of the side effects. For instance, for low blood sugars, for instance. So having a low blood sugar, if you're a senior, if you lose consciousness, you fall, you could have a fracture.
Oh, so yeah, the outcome could be a lot more dangerous in that situation. So monitoring that glucose level becomes critical, I would suppose.
So we adjust not only the therapies, but we also we adjust the goals.
Yes.
It may not be as aggressive.
Oh, interesting. But it may not be necessary later in life.
Correct.
And I know sometimes a senior may be diagnosed with diabetes, but treated for the wrong type.
Absolutely. Up to of all the 1 in 4 that has type 2, hiding among those is about 5% who actually have type 1, which is a completely different disease, which requires different treatments.
Is that right? And they're getting it late in life, which you'd think is unusual too. You don't treat young people the same way as you do older people with diabetes, either type 1 or type 2, do you?
Well, every age has its advantages and challenges.
Right.
And the different medications are approved.
Yeah.
And typically most medications used to be approved for much, this young adult kind of things. And the older people and younger people weren't considered.
Now I would imagine as well, if you're talking about older people, and I don't want to sell us older folks short, but sometimes our learning curve's a little longer for things like dealing with a disease like diabetes.
So education is critical, and not everyone learns at the same rate. And so participating in clinical trials offers an opportunity to sort of sit down and say what's going on. We want you not only to follow what the protocol says, but we want you to eat correctly, we want you to do the activities. Even a small amount of activity increase can really help.
It's what you won't get probably from your attending physician is that kind of time and attention. For more information or to enroll in a study, call 877-567-2627 or go to myamcr.com.